I welcome you all to today's session. Myself Rajita, and here in this session we are going to learn a new topic that is related to the medical surgical nursing. So we are going to learn here about the basic concept of wound and the process of healing. So already we have learned about the inflammation in the last session, right? So we have seen whenever there is any infectious invasion or there is any injury is present over the body surface, we are going to see that there will be presence of inflammatory response. That is basically the immune system response towards the injury or infectious agent, right? Now here, this inflammation actually can lead to the wound formation, and then we are going to see that it will have a proper healing process through which the body surface which have got the injury or infection will be healed and will be get back to its normal physiologic condition. So let us discuss in this session regarding the wound, the classification of it, and the basic healing process of wound as well as the management. Now we are going to learn about the definition of wound, or what do you mean by a wound. So the terminology is suggesting a wound is nothing but is a break in the tissue continuity or integrity of the skin, we can say, which may be associated also with the interruption of the anatomical part functions and their proper physiological condition. So now we are going to learn here about the definition of wound. So wound is basically a breakage in tissue integrity, or we can say it is a breakage into a normal skin integrity which may be associated with a disruption of the anatomical location and functions of the particular body part where the injury has been occurred. So I guess in simple term, we can say the wound is nothing but when there is any reason are lying behind which is causing a breakdown into the tissue integrity and causing certain alteration into the anatomical, functions and locations, then we are going to term that condition as wound. Here, now we are going to read about the classification of wound. The first classification of wound is based on the contamination of the wound. So basically, based on the contaminated or whether the wound is contaminated or not, we are going to classify the wound into two. The first is clean wound and the next is contaminated or tidy wound. So let us discuss here about the clean wound first. So first, about the clean wound, we are also termed this wound as uncontaminated wound. We are going to see that this particular wounds will be often caused because of the surgical incision or maybe a sharp object injury. So you need to make it clear that in a clean wound, there won't be any contamination present. That is the reason the surgical incision is often termed as clean wound, because we know it is an intentionally created incision which will be under a aseptic technique. Even sometimes sharp incision also can cause this clean wound. So what are the features of this clean or uncontaminated wound? So basically it will be incised and it will be completely clean, or it won't be contaminated with dirt or any other things. As well as this clean wound will be considered as healthy wound compared to a contaminated wound. And also we are going to see this clean wound will be often without any unnecessary or inadequate tissue loss. Usually, the healing for this clean wound will be often occurring with primary intention, and also in a primary management, we are going to do suturing to manage this type of wound or clean wound. So you need to remember with clean wound, there is very less tendency of the development of infection for our individual body. That is the reason it is considered that clean wound is comparatively a healthy wound rather than an uncontaminated wound. Next, we're gonna read about the contaminated wound. So basically, here we are gonna see this type of wound can take place because of some crushing injury, tearing or shearing force, avulsion, even certain devitalized injury also can cause this contaminated wound. Often, vascular injury, multiple irregular wounds, or certain traumatic injury will be leading to the development of contaminated wound. So, as we have learned, in contaminated wound, most of the time the surface of the wound will be contaminated with certain external object. That is the reason often wound infections will be associated with this contaminated wound. That is the reason the healing of this kind of wound may take a longer time compared to a clean wound. Even in this type of wounds, often we are going to see the underlying tissues also will be getting affected. Now, you need to make it clear that in case of contaminated wound, often we are going to see there will be presence of devitalized tissue. So the management where we have seen in clean wound that only the suturing will be primary management and it will be getting healed with primary intentions. But here, we're going to read that because of the presence of devitalized tissue, the management would be basically allowing to, devitalizing the tissues that are present or contaminated tissues that are present over the wound. And ultimately, it will be allowing the wound to heal by secondary intention. That is how we are going to manage the secondary or, contaminated wound. Now, secondary suturing often will be used even in severe cases. We are going to see the screen graft, even the flap will be used here to manage the contaminated wound. Next, we are going to read about the second type of classification, which is basically based on the thickness of the wound. So here, we are going to classify again the wound into two. The first one will be as a superficial wound. The next one we can call it as the full thickness or deep wound. So let us discuss first regarding the superficial wound. So the superficial wound often will be involving the epidermis layer of the skin as well as the dermis papillae layer of the skin. We're going to see here the partial thickness or partial superficial wound will be almost always will be involving the skin loss up to the deep dermis layer. Now here the follicles or hair follicles, hair shafts, even the sweat glands will be left behind. So in case of partial or superficial wound, we are going to see mainly the epidermis and the dermis papillae layer will be involved in this type of wound. Whereas in full thickness or a deeper wound will be involving. So as we have seen in partial thickness, only the epidermis and dermis papillae layer will be involved. We need to understand that in case of full thickness superficial wound, we are going to see there will be loss of the entire skin. Even here in the full thickness of superficial wound, often we are going to see the subcutaneous tissue layer of the skin also will be involved. And that is the reason here we are going to see the spacing out of the skin edges. That is the reason the full thickness of wound will take more time to heal. So as we have learned here about the superficial wound, we have seen the partial thickness and full thickness superficial wound. Now we are going to discuss regarding the deep wound. So deep wound often will be involving the deeper layer of the skin. Even it can affect the deep fascia into the muscles, even into the deeper structures like bone, tendons and ligaments. Sometimes those also will be involved in deeper wound. So here we have learned regarding the classification of wound depending on its thickness, right? We have seen the superficial and deep wound. Now we should learn about the classification of wound depending on the involvement of body structure. So here we're going to see the wound will be classified into simple wound, complicated wound, combined wound and penetrating wound. So let us study one by one. So simple wounds often will be involving only one particular organ or one particular site and body tissues. Whereas or in complicated wound, we are gonna see the injury will be almost always involving the part of nervous system as well as the circulation system of the injured part. So you need to make it clear that here in simple wound we are gonna see only the particular site will be affected, but in case of complicated wound we are gonna see even the site will be injured as well as the vascular and nervous structure in that particular area also will be involved in complicated wound. Next we're going to see the penetrating wound, so which is basically will be indicating a penetration of any object towards a particular organ or towards a particular system of the body. So even it can involve the body cavities as well. Next, we're going to learn about the combined wound. Combined wound is basically suggesting to those kind of wounds which often will be involving different kind of body tissues within our individual's body. So that is how we are going to learn about these four types of wound based on the involvement of body structure. Next, we will learn about the classification of the wound based on the time elapsed. So here we are going to classify the wound as acute and chronic. So acute wound basically suggested to those which heals very often, and it will be healing in the primary intentions within 8 hours of trauma. The acute wound often will be managed with the bleeding and it won't be often associated with any complication development. Whereas we're going to see the chronic wound, often it will be taking longer hour for healing as well as the trauma or after 8 hours of the primary trauma also, this wound will not be able to manage with its bleeding and complication development. So in case of chronic wound, we are going to see this is going to take longer time than the usual one to heal, as well as mostly all the complications will be almost always associated with a chronic wound. So next we're going to see a classification of surgical wound specifically. So as we have learned, in surgeries also we are going to make incision, although it will be under a aseptic technique. But the surgical incision or the surgical wounds can be classified into different categories. So now we're going to learn about each categories of different type of surgical wound. So first one is a clean wound of surgical injury. So clean wound basically will be almost always associated with the surgeries like herniorrhaphy or excisional surgery, even surgeries of the brains, joints, and often the heart transplant or any organ transplant. Even here, the infective rate or infection rate is very less. It will be less than 2%. So that is the reason why we are calling this type of surgical wound as clean wound of surgeries. Next, we are going to learn about the clean contaminated wound. Often there will be contamination with the body fluids or other body fluids, but the wound will be having less chances of getting infected compared to the other wound. That is the reason here we are going to call this type of wound as clean contaminated surgical wound. So basically, the clean contaminated surgical wound almost always will be associated with the surgeries like appendectomy, bowel surgeries, even gallbladder, biliary surgeries, even pancreatic surgeries. The infection rate is almost around 10% to 20% here in this type of clean contaminated wound of surgeries. Next, we're going to read about the contaminated wound of surgeries, basically which is often indicating towards those surgical incisions which are being used for acute abdominal conditions, as well as certain open, fresh, accidental wounds which require surgeries. Now, this contaminated wound will be having an infection rate which will be more than 20% or 15 to 20%. So, dirty infective wound basically will be considered those wounds which are often associated with abscess and pyocele, basically the empyema in the gallbladder as well as the fecal peritonitis will be considered as a dirty infected wound. Now, this type of wound will be having a high infection rate. The rate will be often varies from 40 to 70% of the cases. So that is how we are going to classify the wound for the surgical injuries. Next, we are going to also learn about the open and closed wound. So closed wound often means that there won't be any complete tearing over the skin surface. But in case of open wound, we are going to see there will be a completely open edges of the skin surface. There is the difference between a open wound and a closed wound. So I hope till here you are completely clear about the different type of wounds that can be present within or that can be seen in clinical setup for particular individual. Now, depending on the wound, definitely the healing process will differ its time, or the healing process, the duration of it will be differ from person to person. Now, there are very other factors as well, which are physiological and external factors, which will be also affecting the process of wound healing. So now we are going to read about the details of wound healing, that once the wound is occurring, how it is getting healed slowly, we are going to learn here. So, wound healing is often defined as a complex method which is basically used by the body's immune system in order to get the anatomical and functional integrity back, which has been disrupted because of some injury or infectious disease. So I hope by the definition you understood that once the disruption of a particular anatomical location has been occurred, now our body will definitely try to get back the anatomical and functional ability and integrity of the particular part. So that is how our body will be start initiating a process or a complex process which are termed as wound healing. So now we are going to learn what are the basic mechanism of wound healing and what are the stages of it. Now you need to understand, in case of wound healing, there will be involvement of many other substances of the body. Basically the cells like neutrophils, macrophages, lymphocytes, basically the immunity related or immune system related cells, as well as the collagen fibers, the fibrinogen fibers also will be helping in the formation or in the initiation of the wound healing. Now, what are the stages of wound healing we are going to learn here? So often the wound healing will be following a organized pathway. So it will be always starting with a initiation of inflammation. So already we have learned in detail about inflammation, how it is occurring soon after the infection or soon after the injury is taking place in a particular site. So next we are going to learn about once this inflammation stage is over, next there will be presence of proliferative stage. Next, there will be formation or production of matrix synthesis as well as the maturation of it, which will be often followed by a stage of remodeling, which will be generally helping the body part to get back to its normal anatomical position and anatomical integrity. After the remodeling, we are often going to see there will be presence of the stage called as epithelialization, and ultimately there will be presence of wound contractions. So wound contractions often will be involving the activity of myofibroblast. So that is how we are going to see the wound healing process is going to be following organized stages of inflammation leading to the proliferative stage, after which it will come of matrix synthesis and maturation. Ultimately, it will be followed by remodeling stage, reepithelialization, as well as the wound contraction by myofibroblast. So now we are going to read about the types of wound healing. So as we have learned, there will be different types of wound can be present. Now, not all wound will be healed by a same method. That is why the wound healing often will be categorized into two different types. So it will be categorized into primary intentions wound healing, and the second one is wound healing by secondary intention. So first we're going to learn here about the wound healing by primary intention. So, primary intention often will be help to heal those wounds which are considered to be clean wound. So, basically, the primary intention often will be helping to heal the incised or surgical wound which doesn't come under the contaminated wound, or which doesn't have a high chances of the infection development. Now we are going to see this wound edges will be approximated with the sutures, and there will be more epithelial regeneration rather than having the fibrosis development. So I hope you understand the concept. I'll repeat once again here. This type of wound will be having approximated edges. There is a reason we're going to see the reepithelialization will be more compared to the development of fibrosis. Here, with primary intention, the wound healing will be completely closing the area where the injury has been taking place. So, wound healing will be even very rapid with primary intention. So, the duration of the wound healing with primary intention will be less compared to the secondary intention. Often, this primary intention will form or will develop certain scar over the injured part, but that will be very linear and thin. Even the scar will be often smooth, as that there is no presence of extensive fibrosis development. So examples of wound already I have given, which will be often following the primary intention to be healed, are a clean or a surgical incised wound. Next, we are going to learn about the secondary intentional wound healing. Now, wound healing by secondary intention almost always will take place for those wounds which have extensive soft tissue loss associated with it. Majority of the cases where there is presence of severe traumatic injury, sepsis, burns will be involving the secondary intentional wound healing. Now we're going to see, as there will be extensive soft tissue loss in this type of wounds, and secondary intentional wound healing will be having a long duration to heal the injured part. As well as we are going to see here that it will be having development of excessive amount of fibrosis in order to manage the wounded part of the body. That is the reason why often we're going to see in secondary intentional wound healing, there will be presence of wide scar, as well as which will be often hypertrophied and contracted. So I hope you are able to see the burn skin, right, or burn skin. Now here you have to remember, when the burn has been occurred, it has been extensively affected the soft tissues of the body. That is the reason the development of the scar is very wide, as well as there is a high amount of contracture is present. Even the hypertrophy has been taken place into the skin surface. Here, as I have mentioned, in secondary intentional wound healing, the fibrosis development will be more extensive, but reepithelialization will be comparatively less than the fibrosis development. Reepithelialization only will be occurring in the remaining dermal elements and into the wound margin. Here, the contractures as well as the hypertrophies which are present will often cause or often leads to the development of certain disabilities within the normal individual. So often an open wound will be healed with the secondary intention. Even there is presence of wound healing by third intention. So when it is occurred, because after the wound debridement is being done and the control of the local infection has been introduced, wound is closed, then we are going to see the after providing the or after administering the suture in order to close the wound, even if the wound is being covered with a skin graft, then the wound will be start to heal. And that particular method we are going to tell, or we're going to term it as the third intentional wound healing. Often the primary contaminated wound as well as mixed tissue wound will be healed with the tertiary intention. So now we are going to look into the stages of wound healing. So first stage of the wound healing is stage of inflammation. Inflammatory stage often will be termed as lag phase, substress or exudative phase. So this inflammatory phase will begins immediately after the wound has been occurred. So we are going to see it will be last for 4 to 6 days after the initial trauma has been occurred. Now, the features of the inflammatory phase often will be including the 5 major important cardinal signs of inflammation. So already we have learned about the whole process of inflammation, how it is occurring in an injured part. We have also seen this 5 cardinal signs. So these are including a rubor, that is a redness or development of red coloration. The next is scalor, that is increased temperature to the inflamed part. The next is tumor, that is nothing but the presence of inflamed area. The next one is dolor, and the last one is the loss of functions of the part where the inflammation has been occurred. So in an initial period, we are going to see once the client is attaining or getting exposed to an injury, the inflammatory stage will often start to initiate in order to manage or in order to heal the wound. Often here the action of the neutrophils and monocytes will be present. So basically even the macrophages here will be secreting the fibroblastic growth factors, which ultimately will be enhancing the angiogenesis here and will be promoting the wound healing process. Even here, the polymorphonuclear leukocytes will be also present after the 48 hours of the primary trauma, that will be secreting the inflammatory mediators as well as the bacterial oxygen derived radicals. Now this will be often helping in the removal of the unnecessary clots and debris from the wounded or injured part, which will be often helping to prevent the foreign bodies invasion as well as certain invasion of bacteria and viruses. Ultimately, this whole area will be getting protected against any invasion of the microorganism into it, which will be ultimately preventing the chances of the development of infection in this state of inflammatory phase. Chemical factors which are often involved in this phase, already we have learned, includes the growth factor. That includes the platelet-derived growth factors, epidermal growth factors, as well as the transforming growth factors. Here we are going to see the activity of interleukins, the tumor necrosis factors, even prostaglandins, and also will be having effectivity to manage the wound healing process. So this all chemical mediators will be helping to process or to promote the inflammatory process so that prevention of the infection can be taken place as well as wound healing can be promoted. Collagen, fibrinogen also will be involved into this phase to help or to promote the blood clot as well as to stop the bleeding, as well as it will be forming the base which will be promoting the healing of the wound. So in this phase, often we are going to see there will be even development or presence of process like hemostasis, coagulation, as well as chemotaxis. So hemostasis and coagulation often will be helping to prevent the unnecessary bleeding from the wounded part. So basically, initially we are going to see once there is presence of injury, we are going to see the blood vessels will be primarily getting constricted to that particular part. Next, when the histamines and all the chemical mediators will be secreted from the injured cells, we're going to see there will be vasodilatation to the wounded part. But here, then there will be formation of the platelet growth factors, which will be accumulating all the platelet and will be forming the platelet plug associated with certain fibrinous or fibrinogen deposition over the injured part. Now, this process ultimately will be helping to form a platelet plug over the injured part, which will be often causing the coagulation and hemostasis to the wounded area. Now, chemotaxis also will be having a very major role in the management or in the processing of wound healing, which will be causing, neutrophil migration from the blood circulation towards the tissue spaces. As well as it will be activating the macrophages, the lymphocytes, which will be ultimately leading to the excessive phagocytosis into the wounded area, wound debridement or phagocytosis for the wound debridement also will be there, as well as the matrix activation and formation will be completely started in this phase because of the chemostaxis. So as we have learned about the inflammatory phase, already we have learned how the inflammation occurs in details in the previous session. Now we are going to see about the next phase of wound healing, that is termed as the proliferative phase. So basically, the proliferative phase, often termed as collagen or fibroblastic phase. Now, it basically begins once or 7 days after the initial wound. It can last for up to 6 weeks as well. So, proliferative phase often will be depending on the severity of the wound. It will be varying. So, next we are going to see here in this proliferative phase, there will be collagen and glycosamines will be produced from the fibroblasts. Tropocollagen also will be produced here, which will be ultimately aggregating to form the collagen fibrin mesh here in the wounded part in proliferative phase. We are going to see this fibrin deposition and the collagen deposition and mesh formation ultimately will be providing us strength. 80 to 90% of the final strength into the wounded part because of the collagen and fibrinogen mesh formation will be achieved within 30 days of the initial traumatic injury. So as this proliferative phase is helping in the synthesis of collagen and fibrinogen mesh formation, next we're going to see it will be followed by a remodeling phase. Remodeling phase often will be termed as maturation phase as well. So basically this remodeling phase will be durated from 6 weeks up to 2 years even. So in this phase, there will be maturation of the collagen by cross-linking, which will be ultimately responsible for the tensile strength into the scarred area. Collagen production after the day of 42, it will be completely stopped. Remodeling will be taking place just because of the cross-linking of the collagen fibers, which will be ultimately providing the tensile strength to the injured part. Initially, as we have learned, there will be production of fibrin, fibrinoactin, as well as the proteoglycans. Now, this deposition will be occurring, and ultimately, in later phase, we're going to see the collagen protein will be start developing the collagen fiber maze, and it will be forming the base of the scar. So that is how we're going to see there will be presence of the remodeling. Now, based on the tissue injury type, we're going to see this remodeling will be causing sometimes the scar formation. So in case of a very small or clean wound, we are going to see the scar will be very smooth and linear and thin. Whereas in case of a open wound, basically the wound which are contaminated, we are going to see the remodeling phase will be causing a scar formation, which will be often hypertrophied, and this scar will be often very huge in size. So that is how, depending on the severity of the tissue injury, we are going to see the phase will depend or varies for their duration as well as their activity. But the basic steps of the wound healing is same for all the injuries. Now we are going to learn about the factors which can affect the wound healing process. So first we're going to learn about the local factors which are often involved or often affect the wound healing process. It includes the presence of infection. So as I have mentioned, in case of contaminated wound, the wound healing will take long time or prolonged time compared to uncontaminated wound, because infections often will be preventing the wound healing process. Now, it will be often decreasing the pace of the wound healing. That is the reason if the into the localized injured part there is presence of infection, it will be delaying the process of wound healing. The next factor, which is often considered to be affecting the wound healing process, is presence of necrotic tissues as well as certain foreign bodies. Now, this necrotic tissues and foreign bodies, if it is present, definitely we are going to learn that there will be interruption of the blood circulation. Now, you need to make it clear the wound healing process need a proper blood circulation to the injured part of the tissues, because blood circulation will be often helping to produce or to provide all the necessary chemical mediators as well as immune cells to that injured part, so that the initiation of the inflammation and proliferative phase can be taken place. But if the necrosed tissues are present or there is presence of foreign bodies which are interrupting the blood flow to the injured part, we are going to see these reasons can actually decrease the process of wound healing. That is the reason it will be ultimately increasing the duration of the wound healing process. Poor blood supply and venous and lymphatic stasis to the injured part often will be causing delayed wound healing. Hematoma formation, if it has occurred, again it is disrupting the blood flow to that injured area. That is also a cause which can actually delay the wound healing process. Next, we are going to see a large tissue or a poor appositions of the tissues, or a large open scar or open injury often will be having delayed wound healing. So definitely the severity of the injury here is basically considered is a very important factor which will be affecting the wound healing process. So as I have told you that if the wound is small and clean wound, it will be having a high pace for healing. But whereas in case of wound which is contaminated and which is having more tissue loss, we are going to see the wound healing will take longer time for this type of tissue injuries. Now, site of wound. This is also a very important factor in order to maintain or in order to promote the wound healing process. So basically, for example, the wound which are often present over the joints or backs will be having a very slow pace of wound healing. If at all the client who have got the injury, if they're having any previous disease condition, basically the condition like osteomyelitis or certain malignancies or certain immunocompromised condition, we're going to see for them the wound healing process may take longer than the usual one. Tissue hypoxia, if it is present in a localized injured area, we are going to see the wound healing may take longer time compared to the usual time. Recurrent trauma is also considered to be one of the most important localized factor which often will be delaying the wound healing process. Now we are going to learn about the general factors. So generally we are going to see age plays here a very important role to promote the wound healing. So generally with younger adults, the wound healing process maintains a good pace, whereas in older adults, the wound healing process may take longer. A person with obesity or excessive body weight often will be having delayed wound healing. The lifestyle or certain habits also considered is very important factor in case of wound healing. So basically the habit of smoking also can delay the wound healing process. Malnutrition. Basically the malnutrition associated with zinc Copper, manganese, as well as vitamin deficiency plays here a very important role, because the deficiency of this nutritional supplements or nutritional components often will alter the blood coagulation and inflammatory process. That is the reason this will be ultimately can cause the delayed in the wound healing process. Anemia is also considered to be is a very important factor, because anemia often will be decreasing the red blood cells and the activity of the hemoglobins and the blood cells. That is why the anemic people will be having delayed wound healing compared to the normal physiologic state. We're gonna see malignancy often will be associated with delayed wound healing, even immunocompromise, or if the person is having a altered immune system or immune response, we're gonna see wound healing may take longer than the usual one for those clients. The conditions like uremia, jaundice, diabetes mellitus often will be delaying the wound healing process. Metabolic disorders and disorders like human immunodeficiency or acute immunodeficiency syndrome often will be alternating or often will be decreasing the pace of the wound healing. A history of usage of drug like corticosteroid and cytotoxic drug for a prolonged time often will be alternating the wound healing process. Even neuropathies can also alter the process of wound healing. So I hope you got to know now regarding the factors which are often affecting the wound healing process. Next, we are going to discuss regarding the management of wounds. So here, nurses and medical professionals play a very important role, because often even small wounds can lead to form a big or huge complication or life-threatening scenario if not taken care at initial phase. So that is the reason here the management of the wound plays a very important role. Now, the primary or the initial step of the management often includes a history collection and a physical examination. So history collection often will be helping a nurse to identify the person whether they're having any medical conditions or whether the person is having any history of medical conditions, whether they have undergone any surgery recently, whether the person is in an immunocompromised state or not, their usage of medications or the history of usage of medications often will be calculated or often will be collected here. Even the data related to the lifestyle and habits also helps a nurse to understand whether the person have a high risk for the development of any complication related to the wound or not. Once the history collection is done, our nurse definitely would be identifying the risk factor if it is present associated with the client. Next, we are going to do the physical examination for the client with a injury and wound. Here, we are basically going to see the location or the site of wound, the type of wound, whether it is an open wound or closed wound, whether there is presence of any hemorrhage, hematoma formation, or whether there is presence of any tissue necrosis, any symptoms of infection, whether the wound is contaminated or uncontaminated. All data should be noted down after the inspection of the wounded part. Now, if the wounded part or if the injury has been occurred in a vital area, so we are going to do the airway management first. So often we are going to check whether the person is having a patent airway. If not, we are going to check for the patency of the airway, as well as saturation of the oxygen should be maintained for the particular client by provided oxygen supplementation via nasal cannula or a mask. Now, often the injured part will be checked for bleeding. So, if there is presence of severe bleeding, often the management should be done promptly in order to control the bleeding from the injured part. Intravenous fluid are often will be supplemented to the client if they're coming with a severe traumatic injury, which ultimately can cause a huge amount of fluid, electrolyte, or acid-base disbalance. So oxygen supplementation, as I have mentioned, plays here a very important role to manage the oxygen saturation for the body, as well as the oxygen supplementation also helps to promote the wound healing process. While inspecting, deeper tissue involvement also should be noted down. Whether the person have any fractures or any deeper tissue involvement in the particular injury, that also has to be noted here. So next step is the actual management of the wound. Now, if it is an incised and clean wound, basic cleaning procedure would be done with preferably normal saline. Next, we're going to do a primary suturing for the wound, which is basically an incised and clean wound. Now, if it is a lacerated wound, we are going to see the wound cleaning will be done, and then the excision of the wound will be done often. Then the primary suturing will be performed for management of the particular wound or injury. So if the wound is devitalized wound, we are going to see there will be often present of edema and tension over the wound. So in this types of wound, often the wound debridement will be performed first. Wound excision will be helping to excise all the debrided tissues that are present or devitalized tissues that are present over the injured or wounded part. We are going to see the client will be provided for 2 to 6 days to minimize the edema that is being present into the injured part. Once the tissue debridement or the excision of the wound is to be done for the client, and then the excision of the devitalized tissues has been performed, next we are going to give or we are going to provide some supplementation or some proper positioning and minimum drug therapy in order to manage the edema for 2 to 6 days. Next we are going to see there will be performance of suture for the devitalized injury, for the devitalized or crushed injury for the client. Now, if it is a deep devitalized wound, we are going to see after wound debridement, the time will be allotted to granulate the tissue area completely. Once the granulation is completed, then we are going to perform the suturing for those wounds which are deep devitalized wounds. Sometimes, if the wounds are large enough, even skin graft can be used to manage the injured part. Now, in this deep devitalized injury or wound, if we are going to see that tension in the wound is very much huge or more, we're going to do even the fasciotomy in order to prevent the compartment syndrome development associated with it. So depending on the condition of the wound, different management would be taken care in order to manage the client and prevent the complication associated with it. Even while managing the wound, vascular and nerve injury also should be dealt accordingly. So vessels, if it is having a rupture, we are going to see the suturing of the vessels also will be done, preferably with non-absorbable suture material. Now, even if the nerve endings are having a clean cut, we are going to see sometimes the suturing would be done for that in order to manage the localized area and the functional ability of the injured part as well. Now, internal injuries, the injuries like intracranial injury or maybe intrathoracic injury should be dealt accordingly. So, preferably for intracranial injury, maybe a craniotomy or craniectomy can be performed. Intrathoracic injury, intestinal chest tube insertion will be provided almost always. Even in case of intra-abdominal injury, if it is present, it can be managed with a laparotomy performance. So depending on the client's condition or depending on the internal injury that is affecting a particular body part, we are going to see the client will be managed accordingly. So as I have mentioned, if there is presence of fractured bone, even surgery for the fractured bone repair also to be done to manage the wound and injured area. So basically the goal of management of wound is basically to promote the healing of the wound if it is small. Now, once it is having a deeper tissue involvement or maybe a severe wound which involves even the bone and certain deep tissue layers, we're going to see the management will be often done to maintain the functional and anatomical integrity and ability of the client in a proper physiologic way. That is the reason we are going to assess the client first, and depending on the client's condition, depending on their need, we are going to perform different surgical technique or different management to manage the condition of wound and promote the healing of it. So basic role of a nurse here to manage the client with any type of injury or who are going for any kind of management to manage the anatomical and functional integrity, we are going to see antibiotics often will be provided or prescribed to those clients. So here nurses plays a very important role to help the client to adhere towards the antibiotic regimen, because remember, the wound or presence of wound often will increase the chances of development of infection. That is the reason the antibiotic administration have a very major role to promote the wound healing and to control the infection. Next, we are going to see the nurse will be responsible to manage the fluid electrolyte balance for all the patients who are presented with a wound. Now, no matter which type of wound it is, basically a client will have a tendency to lose fluid and electrolyte. So that is the reason here fluid electrolyte balance will be maintained by a nurse, maybe by administration of IV or intravenous fluid. If the client is having a severe hemorrhage, the blood transfusion often is indicated. So nurses here play a very important role to detect the blood group and cross-matching of the blood as well as blood transfusion. A complete monitoring for the client would be done to identify if there is any early sign and symptoms is present or which is indicating an intolerance of the blood transfusion. Next, tetanus toxoid or administration of tetanus toxoid often will be indicated if the client is having a sharp injury or if there is presence of contaminated injury. Even anti-tetanus globulin injection often will be administered by a nurse towards a client in order to manage the condition. After all, a nurse also plays a very responsible role to manage the client, basically their nutritional status. So wound healing needs a very adequate nutritional status. So that is the reason nurses here plays a important role to ensure that the client is in a good nutritional level or they are maintaining an adequate nutritional status. Next, hygiene practice by a nurse should also be ensured here, because hygiene maintenance prevent the chances of the development of infection if a client is present with wound. Often here a nurse would be provided a client with a proper positioning so that the hemorrhage can be minimized, as well as monitoring of the client and monitoring the vital signs and hemodynamic status is very important nursing role to manage the client with wound. The monitoring of the injured site should be done. A proper changes of the dressing at a regular interval, if it is indicated, should be performed by the nurse. Nurse also is responsible here to look for the site of the injury, whether there is any presence of tissue changes, discoloration, which is indicating the development of complication. Now, if there is presence of any sign and symptoms, the nurse should inform the early symptoms to the physician at earliest so that the management and prevention of the complication can be done. So that is the basic nurse's role in order to promote the wound healing and manage the client with or presence of wound. Also, providing a calm and quiet environment, a proper exercise as indicated, as well as a proper psychological support to the client helps to increase the promotion of the wound healing. Now, we are going to read here regarding the problems related to the wound healing. So wound infection is a very common complication. So that is the reason here the patient should be maintained with aseptic technique and hygienic practice. Conditions like diabetes, immunocompromisation, cytotoxic drug usage, anemia in malnourished state, if it is present, a nurse should make sure that they are providing adequate or excess care to the client in order to manage and prevent the complication. Education to the client related to the wound, the healing process, and their role to manage the hygienic practice and maintain their health should be ensured by a nurse. Wound dehiscence is also a very common problem associated with the wound and healing. So here what happens, basically the wound margin suddenly gives away with pain, causing a copious serosanguinous discharge if the tension within the wound is not maintained properly. So this wound adhesions needs a very prompt and emergency treatment and management as well as closure. So to prevent the wound adhesions, basically we are going to see the abdominal wound will be sutured with certain specialized sutured material. Even sometimes we are going to see the retention suture also will be used to manage or to prevent the chances of the presence of wound adhesions. Deeper wound can cause certain problems like paresthesia, ischemia, paralysis. Even it can lead to the development of compartment syndrome. That is when nurses plays here a very important role to screen all the client they are present with the wound, and it is a nurse's role to find out the early indications or high risk factors. Depending on that, a client would be managed and they will be achieving a promotion of wound healing. Sometimes the excessive wound healing also can lead to development of hypertrophic scar as well as keloid. So hypertrophic scars often will be treated or will be prevented by using a pressure garment into the injured part, or which will be definitely increasing the pressure to the injured part and will be decreasing the chances of the development of hypertrophic scar. If required, even client will be managed with the skin graft to manage or to prevent the chances of hypertrophic scar development. Now, keloid is a specialized kind of conditions which basically will be caused because of the defect in the maturation and stabilization of the collagen fiber into the tissue site. Here, the normal collagen bundles will be almost always absent in these cases. So, basically, the treatment of the keloid will be done with steroid injections. Steroid injections will be injected at regular intervals, maybe once in 7 to 10 days. 6 to 8 injections will be generally provided or administered to the client to prevent the chances of the development of keloid. We're going to see the steroid injections often will be given or administered before the excision. Once the wound excision is done, again the steroid injection administration would be performed by a nurse for the client. Methotrexate and vitamin A therapy also will be very helpful to manage the condition of keloid development. That is how we are going to see the hypertrophic scar and keloid formation will be managed or will be prevented along with the wound. So I hope in this whole session you have learned completely regarding different type of wound, the process of or the stages of wound healing. We have also discussed the factors that may affect the wound healing process. We have seen the nurse's role to manage the client with wound, as well as we have seen the basic management to manage the client with wound. And we have learned about certain problems associated with wound healing and complication of wound healing, which basically includes the development of hypertrophic scar as well as keloid. So I hope you have completely clear now regarding the process of wound and wound healing in details. So thank you so much for attending the session. I hope you have enjoyed it maximum. We'll meet you guys in the next session.